Alright, so what we're going to do is, without glasses is going to be EMT. With glasses is going to be the patient. Okay? So, I'm going to be dispatched to a 26-year-old male complaining of shortness of breath. As I walk up, I am looking for my scene is safe. I have BSI. I want to make sure that my 26-year-old male is the only patient I have. I want to make sure that I do have additional resources because the chief complaint that's coming across is shortness of breath, and anything shortness of breath, altered, or chest pain should have ALS coming. Since this is shortness of breath, this is not a mechanism of injury, it's a nature of illness. And so I'm not going to think that I'm going to need C-spine precautions, but just in case something's changed, I'll go ahead and keep that in the back of my mind that maybe we should bring it and I can send my partner if we need it. That right there concludes the whole first portion. Now as I'm getting out, I'm getting my bed, I'm walking towards wherever the call is. I want to know where we're going. So I'm going to ask my proctor, where are we responding to? Is this a house, a school? And I get information that where we're responding to is a single family home. I want to make sure that as I walk up, like the outside of the house looks decent. You know, are there a bunch of cars as I'm walking up? Because if there's a lot of cars, then I'm thinking maybe there's a lot of people inside. Is this a party? I just want to know the general impression as I'm walking up. My proctor tells me that it's a nice home, everything's in order, there's only one car. I'm not expecting to walk into some kind of strange situation. I go ahead, knock on the door, let myself in, taking a look around, making sure still that my scene is safe. I introduce myself, hello, my name is Kristen with Ambulance 123. Outcomes will say a woman, he's back here, help me. As I'm walking through, I'm still assessing my scene. I'm still assessing my scene, making sure that everything is safe, right? Because scenes are dynamic. I'm always keeping that aware. As I'm walking through, there's no one else in the house, just this woman who's going to introduce me to this man, right? Now we go into the room, and he's sitting up on a little side chair, and I see that he is in tripod position. He looks anxious. He looks at me as I walk in, so I see that he's tracking me. I want to know that. That's a normal sign. As I walk over into the room, I say, hey, my name is Kristen. I'm with Ambulance 123. What's your name? Brandon, something's wrong. Something's wrong. Brandon, how long has this been going on? Since I got up this morning, something's up, help me. It's kind of odd, the transition, but you guys get it, right?
Yeah, I get it.
Okay. So it's been going on since this morning. Just with him now being in a tripod position, I see that he's anxious. Just immediately, I'm going to go ahead and ask my partner to put him on a non-rebreather at 15 liters per minute. I'm continuing my assessment, that's happening, and I'm going to ask my partner at this point, just go ahead and get me a blood pressure, SpO2, and a pulse rate. So that's all happening right now, and I'm looking at Brandon. So this is happening since this morning. Has this ever happened to you before? No, never. Okay. I'm now trying to take a look at his overall appearance, right? Still going back into general impression. I'm now with him, right? So a lot of these things are happening concurrently. I want to see what the color of his skin is. And my proctor says that he looks pale. So with him looking pale, I think that I'm doing the right thing by putting him on 15 liters per minute. And I'm able to look at him. Is he sweaty? I want to know color, condition, temperature, as now I'm with him. So my hand's on him. He's cool, pale, diaphoretic, we'll say. Okay, I have ALS coming. He's on oxygen. And I have vitals going over here with my partner. As I'm talking to him, his person, I ask, what were you doing this morning when this started? I just got out of bed and I felt like crap. So with that said, he is alert and oriented times 4, right? I'm getting treatment going on at the moment. He's talking to me, so his airway is patent. I want to make sure that as he's talking to me, since I can't see him, I want to ask the proctor, do I hear like he has like a hoarseness to his voice at all? Does it sound like a normal? And proctor says it sounds like a normal voice. He sounds anxious. So breathing, I'm now with him. I'm standing here. We're side by side, so we'd be here. As I'm here, I want to go ahead and listen to his lungs immediately. So I'm listening in bilateral uppers, I'll listen bilateral lowers, and my proctor says that his lungs are clear bilateral. So both sides and all fields are clear. That is good. I ask, is he breathing? What's his rate, rhythm, quality? I have my partner already working on that. He's breathing at, we'll say, 26 times a minute. It is shallow, right, and labored. So that's all noted. He's on oxygen. SpO2 is coming, so I want to know, now that my partner is working on it, what his SpO2 was. Partner says right before putting him on oxygen, SpO2 was 90%, and now we've improved to 94%. Okay, so breathing is done. Now we go into circulation. I've touched his skin to know that he's cool, pale, diaphragmatic. I want to make sure, as I'm feeling bilateral on his radials, I want to know rate, rhythm, quality of his radials. We'll say that he is 120 times a minute. It is strong and in rhythm. ABC are done. Disability, he's mentally, neurologically intact. I want to make sure that I can get him to my bed without having him exert himself at all. So I try to see if I can get my bed to his room. That way I can just have him stand, pivot, sit on the bed. And I'm going to put him in a high Fowler so he's sitting up straight. Right? And I ask if he's decent. I put him all in, secure him with the seat belts. And now we're making our way out. As we're coming out, I know that I have ALS coming. We'll say that they're going to be here in about 20 minutes. So I have some things to do. I can go ahead and have them meet me depending on where we are. We can rendezvous somewhere in between where they are now and where we are. So we'll go ahead and come up with a point. We're still on scene at the moment. He is critical, but I just want to make sure that I have all my stuff. Right? He's already packaged. We're making our way out the door. As we're walking out, I'm looking just to see, right? I'm looking just to see, do I see any rashes? Do I see accessory muscle usage? I see no rashes. Yes, accessory muscle usage. There's no scars. There's no jewelry, right? So my expose is done. As I'm coming out, I have my partner stay with the woman, we'll say that it's his girlfriend, to get any history, allergies, meds that he can actually get a list for. So he's working on that. I get the initial blood pressure, right? We'll say the blood pressure was 126/80. So now we have respirations, we have pulse rate, we have the blood pressure. He's still critical. I'm going to bring him out to the truck. We're still out there. I want to have my history taken at the moment, right? He's a high priority, so my transport decision is to load and go, but we're going to do this in an organized fashion because if he has any meds, I want to make sure that I bring him with us, right? So with my sample, I know that the signs are he is sitting in a high Fowler's, he's sitting tripod, he is complaining of feeling shortness of breath. I want to know if he's throwing up. I want to know if he has any chest pain. And as I'm asking this, I am feeling, right? Does it hurt at all when I'm touching? He says no. Have you had a cough? I'm going down respiratory questions. And he says yes to a cough, no to vomiting, no to nausea. And then I go back and I say, okay, in the beginning when I met you, you said that you're in pain everywhere. And he says yes, right? So now as I'm here, I'm touching him, right? I'm touching him. And where are you in pain? I'm doing all 4 quadrants. And he says that his whole upper quadrant hurts. And he just feels like he has almost like the flu, right? So my hands are on him at this point. That's my signs and symptoms. I'm asking him now, does he have any allergies? He says no. Medications? He says he doesn't take any medications. I say, okay, at this point, with males, I want to know, do you smoke, drink, do drugs? Obviously, with females, I ask the same question, but if you were a female, I would also want to know when her last menstrual period was, right? And I want to make sure that if she's on birth control, I also ask that question. But since he's male, I just ask, do you smoke, drink, do drugs? He says social drinker, no smoker, no drugs. Okay, noted. So that's for my medications, past medical history. He says nothing substantial. Something like this happened when he was a kid, but he doesn't remember what. Okay, do you have any significant problems in your family? Any history of heart disease, liver disease, kidney, strokes, anything like that? He says not that he knows of. Okay, so that's noted. When's the last time you ate? He says that he hasn't eaten all day because he's felt crappy. Okay, so with that, since he hasn't eaten, he looks anxious. I don't know, is this possibly a hypoglycemic problem in conjunction with the respiratory? So now it's logical for me to poke his finger. I get a blood sugar of, we'll say 100. I know that falls in the normal range, so we're okay with that. Events leading up, now I just want to make sure that I understand what he's been saying. So, Brandon, you have been feeling like this. You've had this shortness of breath since waking up. What time did you wake up? He says 8 o'clock this morning. He barely slept because he kept waking up because he felt so crappy throughout the night. Okay. But he hasn't felt this shortness of breath. He just felt crappy. And then the shortness of breath has been progressively getting worse throughout the day. Okay. And that's why he called 911. So my sample is done at this point. My partner's coming back. There's no meds that we have to take. We're going to go ahead and now start driving to meet the ALS team at whatever rendezvous point that we've decided. So now we're going. Right now, I want to know OPQRST and then U. So O, I understand that he woke up and this has just been progressing throughout the morning. Has anything made it better or worse, Brandon? Have you had to take any aspirin, Tylenol, ibuprofen? Like, have you tried to fix the pain at all? Have you taken Theraflu? He says no, he doesn't have any of that. He normally doesn't have to take any medications at all. So he doesn't even have anything in the house. Okay. Does sitting up the way you are, does that make your shortness of breath feel better? Worse? He says a little better. Okay. Laying down, he feels horrible. He feels like he can't breathe. So that would be his palliation, right? Or excuse me, his provocation. The palliation is when he sits up. Q, quality. So you're saying that your upper quadrant hurts. You're saying that you just feel like you have the flu, like just like muscle aches. He says yes, and when I come here, it hurts more. I just have hands on going down his legs. He says that the quality is like a dull, achy pain to the top, and then just sharp pain, and he just can't find a comfortable spot. R, I ask Brandon, does this pain right here, does it radiate? Does it hurt worse when I'm touching? He says no, over on the right, but on the left, it does hurt worse. So I note that, I know not to touch that again. I'm asking, how about here? And he says, It doesn't move anywhere, but it just hurts more when I touch. Okay, so it doesn't radiate. S for severity. He says this is a 10 out of 10. He says that he's not a baby. He wouldn't have called if he wasn't scared. T, I just confirm you couldn't sleep throughout the night because of this, and he affirms. And you said this once happened to you, so OPQRST, you, when you were younger. You had to go to the doctor and you don't know what they diagnosed you with. Okay, so as now I'm thinking here, he's 26. He looks to be a fit guy. Like, he's not obese. He's fit. He looks like he's an able-bodied guy. My OPQRSTU is done. Now I can get a second vital sign. I want to make sure that it's trending the same. So he was initially 126 over 80s, I think it was. We'll say that it stays the same. We've checked his sugar. He's cool, pale, diaphoretic. Initially, I want to know if we have any change since he's been on the oxygen now for about 10 minutes. Your proctor says he's not as sweaty, maybe just a little clammy, a little pink. He looks better, right? But he's still in obvious pain. He's wincing, right? Does always moving just due to this pain, right? So everything for your secondary vital signs, they stay pretty much the same. When you can't see the person and you're thinking, okay, what can this possibly be? He has clear lung sounds, right? He has pain in the bilateral upper, so both upper right and left. I'm thinking, okay, there is your liver there, your spleen there. I want to ask him, you haven't been sick? Like, maybe I'll go ahead and get a temperature right now, and we'll say that it's 98.7, right? So it's perfect. So, okay, possibilities of it being some sort of infection, I'm steering clear from, right? Steering away from that. You haven't had diarrhea, Brandon? He says no. I already asked him if he's vomited, so now I'm steering even further from a possible infection. So when you can't see your patient, it's a little difficult. So you can ask your proctor now, okay, what's the ethnicity? What's the race of Brandon? And we'll say that he is darker complexion. You're not really sure exactly where he's from, right? Just darker complexion. So now you have to somehow politically correctly ask what's your heritage? So asking Brandon, hey, maybe looking, what's your last name? And let's say that Brandon says Carathanassus, right? Carathanassus, where is that from? That's a different last name. And he says, oh, it's Greek. I'm 100% Greek. Okay. So now you're putting the pieces to your blocks together, right? With him now being of Middle Eastern, right? Now you're thinking, okay, is this possibly a sickle cell issue, right? It makes sense that his liver and spleen, right, where they're basically housing red blood cells, right? All of his joints feel bad. I'm thinking, okay, this is possibly a sickle cell crisis. So when I'm talking to him now, I just want to say, hey, Brandon, anyone in your family, have you guys ever had any problems with sickle cell? And he says, oh yeah, my brother and my dad, but they have it under control. Okay, perfect. Now you're going more towards that issue, right? So that's going to be what you want to have ruled out initially. That's going to be your issue that you want the docs to take a look at. You're not really diagnosing him, but you want to have a good idea as to what's happening. So you explain to him that you don't have any pain medication, that you think that might be the issue. You reassure him, and you're going to keep reassessing him every 5 minutes until ALS gets there, and then you will give them a handoff report. Done.